what I'm going to do today is, one, tell you a little bit about the program. We've been in business now for 3 years. Two, help explain a little bit of the approach we're using in research in partnership with ISB. And then three, invite Lee and Jennifer to come up, and then we'll respond to your questions. But before I start, I'd love to hear from a few of you. And my first question is, when you think about wellness, what does that mean to you? And this is audience participation. Somebody, help me. Not being sick, okay, that's good. What else have we got? When you think about yourself being well, what does that mean to you? I'm sorry? Exercise, okay, excellent. Other things of being well, what does that mean to you? Good nutrients. Good sleep, okay, excellent. And I heard someone else in the back? Happy. Happy, okay, I like. And what makes you happy? Being well, okay, we're in a little bit of a circle. Had another comment here.
Yeah, be active.
Be active, okay, excellent. So we're starting to get some definitions, not being sick, being active, but let's follow this theme of being happy. Like, why do we want to be well? What's that ultimately mean? If we're well, that allows us to do what? Be active, okay, and when you're active, what's being active mean to you? Exercise, doing things with no stress, yes?
Being able to do things that you want to do without being constrained by limitations of your body.
So being able to do things you want to do without being constrained by limitations of your body. And just to follow that, what do you enjoy doing? Hiking, okay, brilliant. Anybody else, when you think about you want to be well, because what are these experiences you want to have?
Get to do science.
Do science, I love that, wonderful. So hang on to that concept of, one, what's it mean to be well as we go through this talk? And then B, why do you want to be well? Because ultimately, what do we know about Americans? Very few people woke up today and thought, today, I'm going to focus on being healthy. But what people are interested in, and what people do aspire to do, is have life experiences. And so we're trying to make that linkage. If you're well, then you can have the experiences you aspire to have today, and more importantly, in the future. Now, it has been the most extraordinary honor for the past 4 years to work with Lee Hood. It's been unbelievable. But a lot of you have had the chance to work with him directly, and I was thinking about this, and what's amazing about you, Lee, is you're a trailblazer. And so he's literally out there forging new territory and breaking down barriers. And so when you think about the idea of launching a new industry, especially an industry between healthcare and science, that's pretty audacious. But because we have Lee, because we have Nathan Price, we at Arivale don't look at roadblocks. We see this wide open road, and we see extraordinary opportunities to actually accomplish what we need to accomplish because of Lee's vision and his guidance that he gives us all of the time. Now, I'm going to show you a couple slides that Lee shared with you yesterday because it's the foundation of what we do. Lee shared with you there's 3 drivers of human health: 30% genetics, 60% behavior, lifestyle, environment, and 10% the healthcare system. So I've been a trustee at Harborview Medical Center for 14 years. I recently completed a term at the University of Washington Medical Center. Healthcare is critical to have, but how upside down is our economy that we're spending 18% on the smallest slice? And so at Arivale, we're focused on the 90%. The next thing, of course, is that if you look at Americans today, roughly 2/3, or 100 million people, are suffering from 2 or more chronic disease, non-communicable diseases, that ultimately are most impacted by behavior, lifestyle, environment. And ultimately, this other slide that Lee introduced me to, which I love, what do physicians have as their primary tool? Because in medical school, of course, you get about 4 hours of education on nutrition and exercise, so they turn to medications. And as Lee shared with you yesterday, of the top 10 grossing drugs in the United States today, most effective is helping 1 out of 4, least effective is helping 1 out of 24. Think of the billions we're spending, and probably doing more damage than good, I would propose. So let's talk about Arivale. Arivale is very straightforward. And what we did is we did a IRB-approved study in 2014 and then took this program and what we learned to market, and we've had about 3,000 people go through the program so far. The program's really straightforward. There's 3 elements to it. It's data, it's coaching, and that translates into actionability and then ultimately outcomes. And this is the idea of how do we help people optimize wellness and avoid disease. Now, when you look at the data, and this is the vision that Lee and Nathan brought to the table, is that we're a system. And I'm a consumer healthcare guy, and so it was so fascinating to me to watch consumer behavior because consumers are out spending money on microbiome. Then they'll go to a different company and they'll get information about genetics. They'll go to their physician, and get a little bit of blood data that's not related to anything else. Very few places can they go and understand their cortisol level with saliva. But we're unique in that looking at people as a system. And so we take these complex data sets that on the whole would paralyze your average individual. And just think about consumers. They love data, but they have no idea what to do with it. How many of your friends are taking 10,000 steps to nowhere with their Fitbit? So a few weeks in, they toss their Fitbit into a drawer because I see some tapping going on. What are your step counts, sir? It's because these 10,000 steps aren't linked to anything they really care about. So by taking this systems approach, we take all of this data, and then for you in the room, we would dynamically organize it into 5 health dimensions. So heart health, diabetes risk, inflammation, optimal nutrition. And for each one of you in the room, based on the data we just looked at, we'd say these are the 2 areas we're going to focus on, because this is where you have the most important opportunity to improve your health. And then, of course, because data does paralyze people, we're going to assign you a coach. And these coaches are licensed professional dietitians, backed up by a clinical team, backed up by an independent third-party physician. And so a lot of people are analyzing this data and what you ultimately need to do. Now, I'd love to share my story. This shows you an example of where an individual would focus to start. So for this individual, the data said heart health and optimal nutrition. Now, as Lee shared, I spent most of my life trying to be healthy. In 1977, in Eastern Washington, I opened a health bar with supplements and juices and protein way before people were thinking about it. And then I've been on the Harborview board for 14 years because I'm passionate about it. I have a concierge physician, and I like to compete in Ironman triathlons. So I said to Lee, as we did the study in 2014, yeah, I'm going to be the healthiest person in this study. And so my data comes pouring back in, and my coach says, Clayton, you're pre-diabetic. And I'm like, okay, that is somebody else's data. That could not be me. But she helped me understand that I have genetic variants. Oh, and a little footnote. About 6 months before, I'd gone on a paleo diet because I thought, those paleo triathletes, they seem to be faster. I'm going to give that a shot. So I'd gone on this paleo diet, but given my genetic makeup, I actually cannot process a paleo diet. My coach helped me understand I need rich, dense, complex carbohydrates in every single meal. So how counterintuitive is that? Think of America today. All these people doing N of 1 experiments of, the paleo diet, lower my inflammation, clean up my blood, and it had exactly the opposite effect. So that was data point 1 I learned, this guy who thought he was so healthy. Second thing she shared is, Clayton, you have toxic mercury levels. Of the 108 people, your mercury is higher than anyone else's. And studies would indicate that far in the future, it would have impact on your neurological functions. Like, how could that be? I get a physical every year. And so once again, the power of a coach in helping you understand data. So she says, do you eat a lot of tuna sushi? I'm a salmon guy. Okay, that's not the source. Well, how old are you? And at the time, I was 53. And she said, do you have a lot of old fillings? Well, for a decade, my dentist had said to me, we should replace these fillings. And I'd always respond, yes, we should. But there was no reason to do it. And so now I've got this data sets, had the old amalgams fillings replaced that were leaching mercury, and about 6 months later, my mercury levels normalized. And so what's been interesting at Arivale over the past 3 years is that when anyone signs up, and I hope at the end of this all of you do, first thing I do is I send you an email with my cell phone number and my email address. So I get to talk to about 2 members a day, and it's amazing because what I hear consistently is, 1, this is the first time anyone's looked at me as a system. Like, you've taken my data and you've actually translated it into something that I can do. And second, I had this coach who actually cares about me. They often use the word loves me, and it understands what I want to do and what I want to accomplish. And so we think that's the power of bringing this to the consumer market. It's data, but it's translated through coaching. This is just an example of the dashboard, and once again, it gives you a sense of the systems approach. So we talk about single genetic variants, we create polygenic risk profiles for a number of elements. We look at over 80 different clinical analytes or 80 different blood metrics. And of course, you know a typical physical, they're going to look at 20 or 30. By looking at 80, it's really a reflection of your life choices to date. And now all of a sudden, this Fitbit data brings it to life. So that we've got some relevance with the Fitbit data. Now, another thing that's powerful, obviously, in this world we live in is how do we make the coaches omnipresent, but in a very friendly way? So our app has become a very powerful tool, and some of our members are on the app 2 or 3 times a day with their coach. I have dealt with my diabetes risk. I've optimized my heart health, and so now, no surprise, as a startup CEO, I'm working on stress management because my cortisol level shows I've got some interesting opportunities there. And my coach has helped me understand a lot of that is dealing with lack of sleep. So she said, okay, Clayton, what are you willing to do? I said, you know what? I'm willing to try. I will stop working at 10, and I will go to bed by 11. So the Arivale app takes over my phone at 10 o'clock, and it says, Clayton, swipe right if you're going to quit working. And then at 11 o'clock again, it swipes right if you're going to go to bed. Now, I often don't swipe. And so, but she gets my Fitbit data, so she's actually seen my sleep patterns. Once again, the idea of this data set. And my goal is to be an extraordinary CEO and to do relatively well in Ironman Canada. And so she sends me a little note and says, really, Clayton, 5 days in a row of 5 hours sleep. How's it going being a good CEO and your training? And once again, that's the idea. It's not data because clinical trials tell us we should. It's, Clayton, you've got 2 pretty audacious goals. You've agreed to achieve these goals. It's a couple easy steps you're going to do, but I see you're slightly off track. What can we do to help with that? So that's the program. So let's look at what have been the results. And we look at the results by looking at clinical labs, by looking at engagement, and looking at changes in attitude. Now, the first thing we want to know is, are only the healthy people signing up for Arivale? Because clearly that wouldn't be very impactful if that was the case. Of our first 4,000 clients, they look like America. If you look at BMI, 43% normal, 36% overweight, 20% obese. You can see the same data for blood pressure and lipids. So this is a cross-section of America that signed up, and we actually love that because it shows a really diverse audience. So the first thing, and especially in the medical community they've been curious about is, if you look at evidence-based ranges, and we use LabCorp as our partner, and so standard following their ranges, what's your ability to actually take people who are out of range and move them in range? And they've actually been amazed by the results. The way to look at this is that these are the top 4 health dimensions. So heart health, inflammation, nutrition, diabetes. These are some of the analytes we look at. And what you see is that at 6 months for heart health, if you look at the total cohort, 20% of people who were out of range moved in range. Now, I appreciate you're a scientific audience, and so aggregating data is probably not very impressive. And so we have both our clinical team that Jennifer can address and our scientific team, but we actually dive in and we look at every single analyte. And just to give you a couple ways to preview this, so let's look at hemoglobin A1C. So the headline is, the percentage of out-of-range members decreased from 37 to 23 in the total population. So that's looking at everyone at month 6, if they have months 12, month 18, or 24. But then if we dive deeper, for all members, you can see the 0.18% decrease on an average of 12 months. Next headline is this red line for people who are highly out of range, a 25% decrease. And then ultimately, why do we care about this? And so I'm just going to fly through 3 different analytes, but this trying to give you a sense of the rigor we have about looking at data and really saying, what's our ability to prove that we're actually optimizing wellness? So this shows you for omega-3, really important in terms of heart health. Look at that in terms of going from out of range from 80% to 40%. Pretty extraordinary in terms of the impact that'll have long-term on people's health. Vitamin D, something that's so easy to address and such a big problem across the country, or such a big opportunity, going from 42% out of range to 16% out of range. So a lot of data, and we spent a lot of time looking at these clinical markers. And because we're driving these type of results, we're now launching with a number of healthcare systems that want to introduce Arivale to their patients. Something that's been interesting when we've launched with employers. So in Seattle, for example, most of you are familiar with the Sabi Corporation, Intuit down in California. I'll show you Colgate in a moment. But a number of employers have made Arivale available. And what they've been impressed by is how quickly attitudes change of their employees. So overall, if you like, my health's on the right track, improving by 30%. I understand how to live a healthy life, 22 points. And what a lot of employers are startled is that coming into the program, 10% of their employees feel like, I've lost control of my life. And then 6 months later, that drops down to 3%. And imagine that, if you feel like you've lost control of your life, but all of a sudden you get a coach, you get a goal, you start to get some energy, you feel better, pretty extraordinary impact on the employee population in addition to the individual population. And then the final slide we don't have up here is that most wellness programs are really considered highly, highly effective if they have half of their participants in month 6. And in the 4 years we've been in business, we consistently have 90% of the participants in months 11 and 12. So high, high levels of engagement. Now, the research platform, and as a business person with no science background, I'm so far out over my skis speaking to you about this, but I'm going to give it a shot. First, we're so fortunate because of Lee and Nathan and the individuals they brought to help guide us in building this company. And what's fun is that once a year, we get all these individuals right here in this room. And I wish we had videos of some of the conversations because they can be quite heated. But as you appreciate, Larry Smarr, probably the father of microbiome. He goes everywhere with a plastic model of his intestines, which is fun to have lunch with him. Ralph Snyderman, considered the father of personalized medicine. Of course, you know George Church. And so these individuals have helped us guide how we've built the program overall. Now, we've built and we've been building it really in partnership with ISB, and a lot of the ISB team here has been working on it. It's been under Lee's guidance. Nathan comes over and meets with the team every other week, so it's just an extraordinary partnership we've got between ISB and Arivale. But there's 3 dimensions of how we're looking at data. The first is through this correlation network, and I'm going to talk more about this on the next slide, but it's on a non-hypothesis basis, saying where do we see correlations between all of these data sets? And we're somewhat unique in the data sets we're collecting, which I'll show you in 1 second. Something that's been really powerful, because we draw blood every 6 months, is to see transitions. Transitions from not being very well to actually helping people optimize their wellness, and often, sadly, transitions into disease states. And so, for example, we had a member, been with us for 2 years, shared with us that she'd been diagnosed with stage 4 pancreatic cancer. And so, why is it normally diagnosed at that stage? Because there's no early signals. And that's part of the power which all of us in this room and we at ISB and Arivale can do, is that because we biobank serum and blood from every single blood draw, we were able to go back to 4 different blood draws and say, oh, look at this protein that's completely out of range compared to the other 32 members at that moment in time. So these longitudinal transitions are really helping us start to understand how to think about what is the right omic to look at. And then, of course, correlating all of this to, in this room right now, each of you have a predisposition for lots of different diseases. So if you think about, for example, Alzheimer's, the team has put together a polygenic risk profile and looked at over 1,400 different variants. Then we've taken our first 3,000 individuals that have not been diagnosed with early cognitive decline, taken that polygenic risk profile, put them into 5 quintiles, and then once again, on a non-hypothesis basis, say, what's unique about the quintile that's at highest risk? So really interesting to take a genetic predisposition and then look at all of these other data sets we have. Now, the way we approach this, in addition to the data sets that I shared with you, that we share with our participants, we also do discovery assays in proteomics and metabolites. And then, because our coaches are sometimes having weekly conversations, definitely monthly conversations with our participants. We're collecting a lot of real-world data that we're also putting into this data set. So we take these data sets, do the integration and analysis, and then of course what's powerful is looking at everything from the efficacy or side effects of drugs, looking at longitudinal data, looking at the opportunity of what is the right omic to be targeting over time. So when you think about our multi-omic research platform and some of the work we're doing here, first it's based on extraordinary density. Second, it's based on longitudinal data, refreshing it every 6 months, and then determining what are the other data sets that we should be looking at. I wanted to quickly just give you some highlights of some of the work we're doing to give you insights into how we're bringing this to life. So Colgate. I didn't appreciate that half of the world's population uses a Colgate product for oral care. And so Colgate had followed Lee in his whole career, and so literally when we initially launched the company, Colgate called into our customer care line and said, "We'd like to talk to someone about the work you're doing." And so they came out, visited us, talked about all their knowledge with Lee, and their thesis is that in the not too distant future, there'll be about 7 different types of oral care based on your oral microbiome. And so we all have unique oral microbiome that we have different types of oral care products would be impactful. So they've put 200 of their employees into the Arivale program. We're creating the dense dynamic data clouds for them. But what I also want to be really clear about, every time we do this, we're also helping people optimize their wellness. And so that drives to really long-term engagement. And then they've added an oral microbiome to this data set to help them develop what is going to be oral care of the future. Providence St. Joseph. And so with Lee's role, really fortunate that Providence St. Joseph enrolled 1,000 of their employees into the Arivale program for 3 years. And they're doing an observational trial, and if you talk to Rod Hochman, the CEO, he's out there saying the Providence St. Joseph system is going to be one of the first systems that actually helps optimize wellness. And it's not just extraordinary at treating symptoms. So we're about a year into looking at data of claims cost data, looking at indications around all the metrics that I've shown you. So this is going to be a really powerful project for us. And Jennifer, our Chief Translational Science Officer, is a co-PI on that and working with Providence and ISB. Hogue, Lee can answer questions. Has probably shared a lot of this with you, but we're just launching a clinical trial where we're taking 200 people with the Hogue Hospital that have been diagnosed with early cognitive decline, putting 100 in the Arivale program, and then for all 200, creating these dense dynamic data clouds. So once again, what is the omics that we could be looking at for people that are early in their transition to a disease state? And then, of course, the physicians are very passionate about the opportunity to how can we take the Arivale program, where we're helping people optimize nutrition, optimize exercise, deal with stress, and a lot of studies would indicate that might have an impact on the transition or the path of that disease. So the future. This is today, but the team is actually doing a lot of work to prepare for what are we going to be doing in just 10 months. Now, the first thing is that we were really honored that, once again, based on Lee's work, the Washington State University, which you appreciate, launched a new medical school this fall, made Arivale available for all of their students. And I think, Jennifer, about 80% enrolled. And they also, Lee is working with them in creating curriculum on scientific wellness for this medical school. And so what the dean is out saying is we're going to be the first medical school that's actually teaching physicians how to help keep their patients well, and once again, not just be focused on treating diseases. So this is a big, big deal and like a really powerful, exciting new insight. I'm sure you've all seen, because we brag about it everywhere we go, that the work that we did in the study, the IRB study, with only 108 individuals, was on the cover of Nature Biotechnology in August. And so that really helped raise the discussion and helped us have a number of other partners come to us. But the vision of Arivale, optimized wellness, and we've proven that we can do that very effectively. So now we also need to transition to what are we going to do to help individuals mitigate or avoid transitions to disease states. And the vision is that in January, we're going to launch Alzheimer's and 7 other disease states, everything from addiction to Crohn's to IBD. And what we're going to do is take the same exact vision we have for wellness of taking a systems approach, helping people understand What's your genetic predisposition? What is the impact of your lifestyle? What's the impact of your family history? And give them, we're going to have to figure out in the regulatory environment how we can do this, but give them insights into, right now your risk overall is X, and with the right actionable recommendations, we can start to help you mitigate your transition into that disease state. So that's the big idea. And then while they're bringing up chairs for Lee and Jennifer to join me, what this is really all about for us at Arivale is we're passionate about helping individuals optimize wellness and avoid disease. And a couple stories, and these are all on our website, so I encourage you when you have a chance to take a look. Kirby, almost all of his markers related to heart health and stress were in the red. And here is, this father, young kids, wants to be there for the future of his family, really startled what he learned when he entered the program. Heather had been working pretty much her whole life to lose weight, and she'd gone so far to actually take a 6-month leave from work to focus on trying to lose weight before Arivale to no impact, enrolled in the Arivale program and dropped 40 pounds, and that was back in 2015, and she still kept it off. And she's a billboard for the program in terms of weight loss is very complicated, and helping people understand your genetic predisposition for it and then get the right steps to optimize your overall wellness can be really powerful for weight. Marty showed up. Marty had never met a vitamin he didn't like. And so he literally was trying to be well, spending $400 a month on supplements. And of course, his coach had to say, Marty, it's kind of sad, but you're actually peeing most of those away. And so Marty's now spending $25 a month on supplements and has extraordinary improvements in all of his health markers. And then Nita, she had a hip replacement. And what's so interesting is so often when we go through a disease state, be it breast cancer, be it a surgery, a lot of people see their health really decline because they don't have the right coaching, infrastructure, data to get back on the right track. And so that was a great example there.